doing a general lameness examination. This dog's under full anaesthetic, which is probably not the most ideal way of actually examining them, but in this situation we've already gone through that process. So when you start your lameness examination, what we want to do is just have a good feel of all the various joints. So we just want to run right through, see if there's either overextension or what we class as crepitus, so in other words we're getting grating within the joint. So going through, having a good feel of all those toes, putting pressure on them to see if they overextend, come back the other way just to see if they all have what we class as a normal range of mobility. Obviously check through the various joints within the toes just to see if there's any laxity or otherwise. Checking that from a lateral perspective to see if there's any laxity there, and then we need to check it from what we call a DV perspective to see if there's any mobility there at all, because if any of those little collateral ligaments are damaged in there, we'll end up with them overextension. Come up to the hock, just have a good feel of the hock to see if there's any laxity within the hock, and then we just want to also check the normal range of mobility, see if it fully extends and fully flexes. And while we're doing that, we're also checking to see if there's any what we call crepitus there again. Run our fingers up the long bones just to have a feel if there's any lumpiness or bumpiness. We're not going to get an indication of whether it causes pain at this stage because the animal's under anaesthetic. And we come up to the stifle, which is probably the area that we find most of our lameness problems. There again, what we want to do is just see what is the range of mobility. Does that joint fully flex and fully extend, and when it's doing that, is there any grating taking place within that knee itself? Now the stifle is made up of effectively 4 bones. You've got the tibia and fibula, you've got the femur, and then you've got the patella coming through there. So they all interact in one way or another. So there again, with the patella, we're just seeing if it's sitting nicely within the groove that it should, or whether it's actually popping in or out, either medially or laterally. In this case it all feels fine. Now we want to find out whether there is any laxity within the actual stifle, because it's held together with what we call collateral ligaments on the outside and on the inside, and what they do is they stop that sort of, well, they prevent the leg from bending side to side. And then within the joint we have 2 ligaments called the cruciate ligaments, and what they do is that they prevent cranial draw, basically, in other words, the movement of the tibia in relation to the condyles of the femur. And what we're looking at is whether those 2 points are moving. And when we're checking cruciates, it's important to check them in full extension and then full flexion. There is another test that we can use for the cruciates. It's called cranial tibial thrust. We're putting our finger up on top of the crest of the tibia, and then we're actually trying to put pressure right through that joint, and you'll often see movement of your finger. But to be honest, I find it's a test that I find hardest to confirm whether it's a cruciate injury or not. Moving on up the leg, there again it's actually harder to feel around the long bones of the femur, but it's always worthwhile just having a little bit of a feel. And coming up to the hip joint, there again, what we want to look at is what's the range of mobility. So we're looking at how far that leg will actually extend caudally, and then how far it will go forward cranially. And when it's doing that, it's a good idea just to have your thumb over the greater trochanter of the femur and just feel whether or not you're getting any grating when you're moving that leg around. Now there are a couple of tests that we can use to see whether there's laxity within that joint. It's what we call the Barlow's test. So what we're going to do is put our hand underneath the femur itself, and we're going to just sort of gently push down but push up from the inside, and what we're trying to determine is there any laxity within that ball joint? Is it coming in and out of the actual socket as we put that pressure? Now the next test, Christy, I'll get you just to, with your hand, we'll just pop this little dog on her back. This is what they call the Ortolani test. So what we're doing here is we're actually putting her knees perpendicular to her body, pushing down, so we're putting pressure through the actual hips themselves. And then what we're trying to do is do the splits. And it's not easy because these dogs want to move in all directions. And what we're feeling for is there a popping as we actually do that? And I can't feel anything in this case. You can actually do it individually on each leg if you want, but it is quite hard because you're getting wobbling. But what we're doing when we do this is imagine the ball was sitting in the socket, and when we're putting pressure down on it, what happens if there's any laxity, it actually comes out slightly. And as we move the leg down, it pops back in. So that's what we're checking for, whether there's actually that laxity as it pops out, and then as we move it back down, it pops back in. So that's pretty much a full range of examination of the hind legs, and then obviously we're going to tie this in with our radiographic investigation, which we've already undertaken in this case. And so basically in this situation we suspect that there is actually a partial cruciate tear within the right stifle joint, and a little bit suspicious about a little bit of laxity in what they call the tarsal metatarsal junction on the inside of the hock on this leg as well. Thank you very much.